New numbers show that the number of teenagers visiting an emergency room for an eating disorder has increased. Listen to this. 121% since before the pandemic in 2020. So now the Canadian Pediatric Society is urging primary care providers to screen all adolescent patients for eating disorders during routine checkups. Joining us for more on these new guidelines is Amanda Rafool, a professor and health researcher from the University of Toronto. Good morning.
Good morning. Thanks for having me.
These numbers are pretty staggering. I mean, according to the Canadian Pediatric Society, up to 5% of 10 to 17-year-olds are dealing with eating disorders, and many go unrecognized or experience delays in getting diagnosed. So we know that symptoms can look different for every patient. So what are these new screening guidelines? What do they look like?
So the new screening guidelines are really important because they encourage pediatric care providers who see young people, children, and teens to do eating disorder screening for all teenagers, as you mentioned, but also to do screening for any children who show one of the red flag signs that they indicate. That can be unexplained weight changes, not reaching their weight or height that's expected for their age, showing symptoms that we know are associated with eating disorders, like delays in puberty, or even having changes to their mood or their behavior.
So what does the screening look like? Is just the doctor asking questions?
In some cases, the recommendation is some simple, open-ended questions about how the child is feeling about their body, their weight, their mood generally. And in other cases, the guidelines recommend some more targeted screening questions. So about intentional changes to their weight, whether they're engaging in some harmful behaviors. And then depending on how the child might answer, the guidelines provide some suggestions on how primary care providers can refer the child to other services or even go ahead and engage in treatment with the child during the visit.
ER visits for eating disorders increased by 121% when we compare those numbers from before the pandemic. What's the big reason for that?
Of course, the pandemic put a lot of pressure on young people. There were pressures around mental health generally, being forced to stay at home, not having the regular routine around school or even food and physical activity. But one other major contributor is likely that young people were spending a lot more time online and a lot more time exposed to social media.
So let's talk about that a little bit. What role has social media played in all of this? And what is something called body checking? This kind of, I guess, is a trend right now on social media?
Yeah, body checking is a trend that existed before social media, but has obviously become a lot more amplified, more time people spend online. And it's engaging in different behaviors where you're looking and surveilling and spending a lot of time concentrating on certain parts of your body. Social media in general just exposes young people to a lot of unrealistic ideas about what bodies should look like, as well as really dangerous and harmful information about food, exercise, and body weight that they're really vulnerable to being exposed to.
So jumping ahead a little bit, so if a patient does need treatment, what options do they have?
The first step is always to go to your primary care provider. So whether you're a young person or you're the caretaker of a young person, it's to go to the primary care provider and emphasize some of the signs or warning symptoms that you're concerned about. And from there, the primary care provider can use these guidelines or even refer you to more specialized services that are available in your area.
Well, and that's the big question, right? Available. What sort of wait times are people facing?
That's a really significant concern right now, not only in Canada, but globally. There's always a shortage of services around eating disorders. Increasingly, especially in provinces like Ontario, there is a new funneling or a channeling of services to help streamline so that young people can try and see someone as soon as possible, even if they can't seek full services. So I would really stress that patients and their caregivers emphasize that even short-term, quick, one single session options are something that they're interested in if they're struggling.
Amanda Rafool, thanks for joining us this morning.
Of course, thank you.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.